I'm Dr. Sarah Ashby. I am a pharmacist and I have my master's in public health. I am the coordinator of the Opioid Stewardship Program and the Drug Diversion Prevention Program at UAMS. I also teach in the College of Pharmacy, where I'm a clinical assistant professor. And today I'm going to be answering some common questions about opioid medications. Today's first question is, what are opioids? Opioids are medications used to treat pain that are prescribed by a healthcare provider. There are some side effects with these medications, and we'll talk about them in just a minute. The next question is, when would I be prescribed opioids? Opioids we generally reserve for pain that is not well treated by over-the-counter medications such as Tylenol or ibuprofen or naproxen. And there are several other ways that we can reduce pain to avoid opioids, including putting ice or heat on an area that is sore, as well as sometimes physical activity or physical therapy can help. And also reducing your stress level can also help reduce your pain. So we try those first, then we go to opioids if needed. Next we have, what should I expect when taking opioids? There are two different types of pain. We have acute pain and we have chronic pain. So to explain the difference, acute pain is where it's a short pain, such as I stub my toe, and it is going to go away pretty soon, even though it won't feel like it right now. And then there's chronic pain, which is defined as pain that has lasted greater than 3 months. So you might think of someone who has cancer has chronic pain. So these acute pain and chronic pain are treated two different ways. We always try to use the lowest dose for the shortest amount of time to help prevent any side effects. Next we have, what are the side effects of opioids? The most common side effect that people think of with opioids is drowsiness or dizziness, if they make you sleepy when you take them. However, there are other symptoms that could happen. Some people actually itch all over, perhaps if they have an allergy to the medication. And a major one that people seem to forget about is constipation. So it's very important to make sure that you take them as prescribed so that we can minimize these side effects. Our next question is, will I become addicted to opioids? Addiction is always a risk when you take an opioid medication. This is why it's important to follow the directions given by your healthcare provider. We want to take the lowest dose that treats your pain for the shortest amount of time possible. There is a difference between addiction, dependence, and tolerance. Tolerance is where you're taking medication for your pain over time, and the dose may need to be increased so that your pain can be controlled. A lot of people commonly refer to this as your body getting used to it. So it's important to work with your healthcare provider so that they can ensure your dose is appropriate. And this is typically with chronic pain. Dependence is when you actually have withdrawal symptoms, which is when you stop taking the medication. That still doesn't necessarily mean that you're addicted. It just means that your body got used to having it in your system. Addiction is where you actually have changes within your behavior or your physical signs and symptoms concerning the opioid medication. So this may be being very irritable when you're coming off the medication, possible to have the shakes. It's also, you can have changes in behavior, such as focusing on finding where you're going to get another prescription. So typically with addiction, you're looking at obtaining the medication, whereas with dependence, it is normal for your body to be used to having the medication. which is why we want you to take it for the shortest amount of time and the lowest dose. But those who do have to take medication for chronic pain, tolerance is something that you need to work with your doctor to make sure your pain is treated appropriately. Our next question is, what is opioid misuse? Opioid misuse is when an opioid medication is taken differently than it's prescribed by your healthcare provider, or if it's taken by someone who it wasn't prescribed for, but it's for that patient in that time period and to be taken as prescribed. Misuse could even be if you're taking twice as many as you're supposed to, or taking it more frequently than you're supposed to. Which brings me to our next question, what do I do with unused opioid medications? It's a good idea to never keep unused medications in your home. So the best place to dispose of them is to go to a take-back box or a take-back event. Typically, your local police department has a take-back box. Some pharmacies have these available also. For a take-back event, the DEA normally hosts 2 a year, and it's important to bring your medication and dispose of it properly by giving it to them. If you need to learn more about a take-back location near you and you're in Arkansas, then go to artakeback.org. A question I'm commonly asked as a pharmacist is, can I drink alcohol while I'm taking my opioid medication? The answer would be no, and it's for your safety. Opioid medications cause drowsiness and some sedation. Alcohol also causes sedation. By putting these two on top of each other, their effects are increased. What this does to your body is it slows down your breathing, which we call respiratory depression, and it can slow it to the point that it actually leads to death. Another question I'm commonly asked is, can I take Tylenol if I'm taking an opioid medication? The real answer is, it depends. Some opioid medications actually contain Tylenol within them, but they use the fancy name acetaminophen or APAP, which is APAP. So you may see that on your prescription bottle. For instance, there's oxycodone acetaminophen, which most people might know as Percocet. That contains the acetaminophen, so you would not want to take Tylenol on top of taking that medication. This is also true with hydrocodone acetaminophen. Taking extra Tylenol on top of that or the oxycodone acetaminophen would cause your levels of acetaminophen to be high in your body and cause liver damage. In some instances, healthcare providers do schedule medications separately, such as the oxycodone. You may have a tablet for oxycodone, and you may be instructed to take Tylenol in a different tablet. So they may be given at the same time, or they may be separate. So it's important to realize if you do have Tylenol in your medication, do not take it over the counter. And then if you don't have it within your medication, then it may help you, but talk to your doctor or your pharmacist first. Our next question is, can I take opioids during pregnancy? The answer is yes, but it depends upon your specific situation because you need to be monitored by your doctor, but we typically try to avoid those in pregnancy because whatever the mother takes, the baby is also taking. For our final question, where is Arkansas in the opioid epidemic? Arkansas is currently rated second in the nation for the number of opioid prescriptions. In 2018, there were almost 94 prescriptions written for every 100 people in Arkansas. The national average in 2018 was 51 prescriptions for every 100 people. So you can see that in Arkansas, we need to take the opioid epidemic seriously, make sure and look out for one another. And the key thing is work with your healthcare provider. With the opioid epidemic hitting Arkansas hard, we have seen an increase in overdose deaths for Arkansans. It's important to know what resources are available. Naloxone helps to reverse an opioid overdose, and this is available at your local pharmacy.